This segment brought to you by my good friends at the Job Creators Network. I love the Job Creators Network because they do so much stuff. They have inspired me because they said, look, we can do a lot with a little. You don't have to have billions of dollars. You don't have to have thousands of people. You can really make a difference by taking a stand and believing in what you're doing. And so they're an inspiration to me, and I love them. And Elaine Parker is going to be joining us now. Elaine is the Senior Communications Vice President of Job Creators Network, and she's also the President of the Job Creators Foundation. And they have a brand new campaign, that they're launching on Monday. They got a conference call today that's pretty cool with the Vice President and small business owners that I'm on. So there's a lot of great things they're doing. Elaine, great to have you with us.
Good morning, John. How are you?
I don't know how you guys do all this. I really don't. We got a conference call today at 2:45 with the Vice President of the United States you guys set up. That's for key small business owners across the United States. You got a big new plan, 10 for 20, that's coming out on Monday. We're excited about that. Meantime, you're flattening the fear. You've got, thousands of petitions by doctors to go back to school. Do you guys ever sleep?
We've got a little spare time on our hands. But we're very excited to have the Vice President speak to our members today. We've had some incredibly engaged small business owners all over this year talking about the economic impact of the coronavirus. And, of course, you mentioned our Flatten the Fear campaign. Our physicians, our partners in this battle against this Black Swan event, they'll be on the line as well. And, we're just excited to hear what the Vice President has to say about what the administration has been doing in putting small business first. And it will also give us the opportunity to give the preview of our 10 for 20 campaign, which we launch officially on Monday. So we're very excited about the phone call today.
So let me ask you, Elaine, if somebody wanted to become a member of Jobs Creators Network, and I know our company has, Ann and I have, that's why we get to go on the conference call today. If they went to jobcreatorsnetwork.com, sign up to be a member today, can they still get on the call? Is there enough time for that?
Absolutely. There is an opportunity to get on the call. They would probably need to email us and ask for the conference call number at this point because most of those numbers have gone out. We do have limited seating, so it is filling up, but there may be some spots left.
All right, so do that. Anybody that owns a small business, just go to jobcreatorsnetwork.com, jobcreatorsnetwork.com. You'll have an opportunity to sign up. It's a great organization. It's not a lot of money. It's the best couple $100 you're going to spend to be. There's different tiers of membership, but and you can get on the conference call today. There's great benefits to it, and they're movers and shakers, and they get things done. So go to jobcreatorsnetwork.com. Tell me about going back to school. The president now really putting the heat on these various school boards trying to get kids back to school. New York City, communist as they are, Bill de Blasio had to cave because 75% of his parents want their kids back at school, or there was going to be mass people very upset there, so they're going back. But all these other schools not. But you went to doctors. You went to pediatricians and doctors, and you got thousands of signatures on a petition. Can you give us an update on that, Elaine?
Yeah, so just a few weeks ago, we did a national petition, and within 48 hours, we had several thousand doctors sign the petition. And they weren't just signing the petition as doctors because they understand the science. They're following the science, exactly what our political leaders are saying to do. And when they look at the science, children have a very, very low infection rate, and they actually have a higher risk of dying from the flu than from COVID. And, if you just look at Florida, where I live, and we talk about Florida all the time, the majority of the cases that we see in children in the state of Florida are kids between the ages of 14 and 17, and at least a quarter of them are asymptomatic. And so when you look at the CDC guidelines, the American Pediatric Association, they all say that children need to be back in school because the overall societal effects of children being out of school is more detrimental than the disease. And like I said, they have a greater chance of dying from the flu than COVID, and there's a very low transmission rate when you look at other countries like Germany or the Netherlands and France. They've all done studies because all of them have gone back to school. And there's been very low spread amongst children in elementary and middle school ages, which is the age that we're focused on getting these kids back to school because they are falling behind, John. And there's at least 22 million kids in the country that actually depend on on 2 of their meals a day from school. And for some kids in very low-income areas, those are the only meals they get per day. So we need to get our kids back into school. We need to make sure that they're not falling behind. And we're going to have a whole lost generation of kids if we don't get them back in school.
So it's not only a lost generation of kids, it's they're going to fall behind competitively to 2 elements, right? Kids that are going to private schools like my son is, because we made the choice to do that a long time ago, and kids in foreign countries. I mean, Elaine, you can't cut out an entire year of a 12-year education, especially at the 3rd, 4th, 5th grade level. You just can't cut that out and say that everything is going to be the same. And that's in so many school jurisdictions in the United States. They're cutting out an entire 12 months, a year of education. What chance do those kids have? They have to compete with other children and kids, adolescents that have had that year. Doesn't that put them at a tremendous disadvantage?
Absolutely. And you know, look, these teachers, many of them want to get back in the classroom. They miss their kids. I have a lot of friends that are teachers. They miss their kids. They miss being in the classroom, having a normal schedule. You know, but you look at the unions who are using this coronavirus to push their favorite liberal policies. You look at their list of demands, John. It's just ridiculous. It has nothing to do with coronavirus. I mean, they want to have taxes on billionaires, and they want to keep parochial. They want to cut off funding to parochial and private schools and charter schools. I mean, none of that has anything to do with coronavirus. They want Medicare for all. Tell me where we have touched on anything that has to do with keeping people safe in the classroom. It has nothing to do with it. So, you know, when you see the unions making this very political, it doesn't hurt anybody but the kids. And we need to put our children first. We need to get them back in school.
Don't doctors matter? Because, you know, when this whole thing started, it was science and data, science and data, science and data. Follow the science and data. It was Fauci and Birx with the real estate scarf, science and data. What science and data do they have that say that they should close schools? And then it's the fake news. Like, for instance, they opened schools in Georgia. Headline. It was an AP New York Times headline. 2nd grader in Georgia on first day tests positive. Well, if you tested positive on the first day of school, did you catch COVID from being in school? I mean, it's the first day. Obviously, you could. That isn't even in the story. And then it's, well, did he have any symptoms? No. The parents just sent him to school, tested him, and called the New York Times. I mean, are you kidding me, Elaine? This is the nonsense, the fear-mongering. That's why your Flat in the Fear was so impactful. This is the fear-mongering that goes on. And these are the people that don't, look, they don't want schools. They don't want football. They don't want scholastic athletics. They don't want small businesses to open. They don't want anything. They want to shut everything down. Why? So they can defeat Trump in November. Then all of a sudden, if Biden is president-elect November 3rd, we'll have magic vaccines, magic cures, magic numbers. Everything will change. And anybody that follows this can't dispute now that this entire pandemic and the Democrats' response is about beating Trump, period.
You know, I don't disagree with you, John. You know, I certainly take, and we take as an organization, the virus very seriously, and we agree with all of the CDC guidelines, and so do our physicians. But they also don't believe that it's as for society that we should stay shut down. The point of shutting down our economy was to prevent our hospitals from being overrun and to give us the opportunity to make sure we had enough medical equipment and PPE to protect patients to help treat patients who were very sick from coronavirus. And we know that coronavirus is very dangerous to people who are over the age of 65 or who have underlying health conditions. That's where we've seen at least half the deaths have happened in nursing homes and assisted living facilities. And so we can protect those vulnerable populations, but we can also, at the same time, get our society back up and moving with proper precautions, get our kids back to school, and get back to some normalcy, both economically, but also from a life standpoint and a standard of living, so that we are participating in life and so that we are mentally healthy, physically healthy. All of those things are very important from a holistic standpoint. It's not just the virus, and we can't let the virus, be worse than everything. We just can't allow that to happen. We're going to have, thousands of people who are victims of this virus who never have it just because of the overall societal cost. And so we've got to start looking at that. We didn't stay shut. We're not going to stay shut down until we have a vaccine, because that could be years. We hope that it's soon. We hope that it's this year. We hope that it's, no later than early next year. But most of the time, vaccines take a long time to produce and a long time to work, and sometimes a long time to get out in society. I mean, look at the number of people who actually get the flu vaccine. So you've got to take all those things into consideration. We just can't stay shut down forever.
So Elaine Parker with us. She is the Vice President of Communication for the Job Creators Network and the President of the Job Creators Network Foundation. So, Elaine, let's get to the flatten the fear aspect, and then I'm going to move on to your Monday announcement. The fear mongering for COVID-19 is reached now a fever pitch. For instance, let me just give you a number. In Virginia, where the governor is still closing things down, in Virginia, the last 5 days we've averaged one or two deaths. 2 days ago we didn't have any. 3 days ago we had one, then two. So, and yet they're still closing things down. They're still mandating bars have to close at 9 o'clock or 10 o'clock. They're still telling small businesses how to operate, etc. And yet there's no deaths here. At what point do people say, where is the data that is backing your mandates?
Yeah, that's. I didn't realize the numbers were so good in Virginia. That is pretty ridiculous, if you ask me. I mean, we're doing better and better in Florida. We're seeing some of the numbers come down as far as cases. But look, I don't let the number of cases scare me, because what a lot of people don't realize is if you test positive, you have to go get tested again and again and again until you test negative to return to work, to, come out of quarantine, basically. For the people around you, you have to test negative. And so if you test 3 times during your illness, that's 3 positive tests that go into the hopper and the count when they release those numbers every day. So when you start looking at the multiplication of what's happening and can drive up some of those numbers, it's hard to believe that the numbers are this high when so many people are wearing masks and following the CDC guidelines. It doesn't make sense. And again, you do need to protect the vulnerable, and the governor of Virginia and Florida and everywhere else should be taking steps to protect people in nursing homes and assisted living facilities and prisons. Anywhere where you have group living like that is where you're going to have the bigger problems. But when it comes to, everyday people who are out and about and living their lives and under the age of 65 and don't have those underlying health concerns, we need to get back to life for our children, for our families, for our mental health, for our economy, all of it. We've got to get back to normal life.
In Florida, the Florida Marlins baseball team, a total of 15 people tested positive. They canceled a bunch of games that they're going to have to replay. Out of the 15 Marlins players, all these are athletes. These are professional athletes playing baseball, 19, 20, 25 years old, perfectly healthy, no symptoms. No one had so much as a runny nose, right? So, 2 weeks go by. Now, two things. Every day they test comes back positive, that goes into the numbers. Even though it's the same person tested 10 times, you've got 10 positive tests. That's the way it's reported up the chain. So that's a little misleading. None of them have any symptoms, not even a cold, nothing, zero, asymptomatic. 2 weeks, they test negative. They go back to playing baseball. There's no change in anything. I mean, this is what is so ridiculous about this. And actually, when they tested positive, the commissioner of baseball, Rob Manfred, was under unbelievable political pressure from the social media shutdown cancel mob to cancel the baseball season, which would have been a disaster for everything. And you know what? It's at least a little bit of a reprieve, even though I have to put up with political statements on the back of the pitcher's mound. I get to watch baseball and watch a game. They wanted to take that away to put people further in depression and stoke the fear. And now Marlins are playing. They're winning again. They're all back playing. Nobody had a single ramification from this or a symptom. Elaine, that's what we're dealing with every day, is the fake news media fear-mongering.
Yeah, it is a shame. I mean, I saw some reports, like I mentioned today, on children in Florida and the cases in Florida. And like I said, at least a quarter of them are completely asymptomatic. And many people are asymptomatic and don't even know that they have it, or they have, mild symptoms. And, that would help reduce people's fear about the disease if they understood some of the symptoms and they understood what risk population that they're in, so that they knew to take extra precautions. And just telling the whole story and putting things in context, that's been, the theme of this campaign, and why we put doctors out there, because they are credible. And these are doctors that are treating people with COVID on a daily basis, and seeing the disease up front and personal. And I will tell you that none of the doctors that we're working with have contracted COVID from any of their patients. So you can treat these patients, and you can take the proper precautions and not get the virus as well. And that's the point of getting back out there. And that's why these doctors are so passionate about educating the public, that we can all send our kids back to school for face-to-face learning, because they're doing it. They want to send their kids back as well. And these are doctors in Texas, Georgia, Florida, Pennsylvania. I mean, they're over the country. There's no state that that they're not in and saying.
We got to
the same
educate.
thing.
We got to educate our children, Elaine. I mean, the fact that we're getting a whole, like you said at the beginning of this segment, a whole generation of kids in America that are cheated out of a year's worth of education is really criminal behavior, as far as I'm concerned. And these people trying to stop these teachers' unions and the Democrats politicizing our kids' education. They're a sick bunch of people. They're really sick. And look, if you don't want to send your kid to school, don't. You're the parent. They're a minor. You want to do online, you want to do a pod, you want to do whatever, do it. But if you want to send your kid to school in a classroom setting, which is proven beyond a doubt to be a superior learning environment, then you should have the choice, because your taxes, for heaven's sake, are paying for the whole thing. Elaine Parker, thanks for being with us. Elaine, are we going to get you on first thing Monday to roll out 10 for 20?
Yeah, let's do it. I'd love to talk about 10 for 20.
All right, 7 o'clock. Put it down. Elaine Parker, Monday, 10 for 20. Can't wait. I think it's a great idea, Elaine. I think it's really going to make a difference. Meantime, Elaine, I'll see you today at 2:45 on the conference call. Hey, if you want to get in on it, become a member, small business owner of the Job Creators Network. Still got time. Go to jobcreatorsnetwork.com. Jobcreatorsnetwork.com.